Good morning, class. This is Mr. Booty. Welcome to English for Medical Sciences. Today, you will be watching the following video twice. Bring your pens or pencil and a piece of paper with you to note down the things considered important. Once you've finished watching the video, please take some time to answer the questions related to the content. Following that, pair up with a partner and prepare for a role play based on the scenario depicted in the video you have just watched.
Good afternoon, Mr. Johnson. I'm Sarah, the radiographer. Today, we'll be reviewing the results of your recent X-ray images.
Hello, Sarah. Thank you for taking the time to explain everything to me.
Of course, Mr. Johnson. Now, let's take a look at the first image. Do you notice anything unusual about this bone in your wrist?
It looks like there's a break or fracture in the bone.
Yes, that's correct. You have a fracture in your radius bone. Let's move on to the next image. Can you identify the abnormality in this image of your spine?
It appears that one of the vertebrae is out of place. Is that a dislocation?
Exactly, Mr. Johnson. You have a vertebral dislocation in your lumbar spine. Now let's focus on the next image. Do you see any abnormalities in this image of your chest?
Yes, there seems to be a shadow or mass in my lung. Is that a tumor?
That's correct. You have a pulmonary nodule in your lung. Now let's move on to the next image. Can you identify the abnormality in this image of your knee?
It looks like there's some fluid buildup around my knee joint. Is that a sign of injury or inflammation?
Yes, Mr. Johnson. You have knee effusion, which indicates fluid accumulation in the joint space. Now let's focus on the next image. Do you notice anything abnormal in this image of your abdomen?
It seems like there's an abnormal growth or enlargement in my liver. Could that be a cyst or tumor?
Correct. You have a hepatic cyst in your liver. Now let's move on to the next image. Can you identify the abnormality in this image of your skull?
There's a fracture line visible in one of the bones of my skull. Does that indicate a head injury?
Yes, Mr. Johnson. You have a skull fracture. Finally, let's focus on the last image. Do you notice anything unusual in this image of your shoulder?
It appears that the bone is partially displaced from the joint. Is that a shoulder dislocation?
Correct again. You have a shoulder dislocation. Well done, Mr. Johnson, for identifying and recognizing these abnormal findings.
Good morning, class. You have just watched a video featuring a doctor-patient dialogue twice. Please take some time to answer questions related to the content. Following that, prepare for a role play based on the scenario depicted in the video. Additionally, there are 5 questions related to the medication topic that you need to answer.
1. What abnormality is present in the patient's wrist? 2. What abnormality is present in the patient's spine? 3. What abnormality is present in the patient's lung? 4. What abnormality is present in the patient's knee? 5. What abnormality is present in the patient's liver?